And go.
Hi, I'm Kevin Wade. I'm a therapist at the St. John Clark Pain Treatment Center. I'm also the campus director and one of the founders at the Center for Neurosomatic Studies as well. One of a group of people, developing neurosomatic therapy and working on therapy with many different kinds of patients. I wanted to talk today about a recent experience I had with a patient who had been referred to us by a dental professional. This woman was trying to have some teeth replaced and bridges put in, and we work with a number of dental professionals who are very keyed into the functional position of the jaw, and as the teeth come together, it's called occlusion, and even into what they call neuromuscular dentistry, where they're looking at the position of the cranium and the bones in the cranium and how the TM joint, or the temporomandibular joint, works from one side to the other, and how our teeth come together as we're doing that. It can be a source of a lot of problems, a lot of really extreme pain when that joint's not working correctly. So we've developed some strategies to help with situations like that, and working alongside some knowledgeable dental professionals, we've really had some success with cases. But one thing I wanted to explain that is kind of hard for people to conceptualize, because it's an idea that's very different from what we're told, and that's about the cranium itself. This colored skull here shows all of the different bones in the cranium, including the temporal bones and the mandible right here. The temporomandibular joint is right there and makes our jaw work. There's something that a lot of people don't know about the cranium, is that all of these bones are movable. These sutures that come across here and divide and separate these bones are separated with cartilage. And it's not movement like you'd get at your elbow, where there's a lot of gross movement happening, but these bones can shift and adapt to positions in your body that cause a counterbalancing type of effect, even all the way up into the cranium. So when we have issues where maybe the maxilla, these two sides of the bones in the upper part of the jaw, start to shift into a shearing kind of position, or if we have issues where the temporal bone on either side, one's moving high and the other's moving low, and changing the aspect of the mandible down here, then we start to have issues about how the teeth come together, how the jaw's moving in that joint up there. That can start to contribute to dental problems and the TM joint problems that we all hear about. So the patient that had come in from our neuromuscular dentist, said, "Well, the dentist just sent me over here. I don't know why I'm here, and what am I doing here?" And I had to explain to her about postural assessment and postural distortion and how it affects the cranium. Basically, in a nutshell, these movements that can take place in the cranium, they're all part of what's called the writing reflex. Our nervous system wants our eyes and our inner ears to be level to the horizon so that we can maintain balance. When we start to get off balance, our body shifts and is responding maybe to an injury or a structural asymmetry of some sort. The nervous system takes over and says, well, how can we get this skeleton in the best alignment that can possibly be given this certain set of circumstances, right? So the writing reflex takes over and really tries to get our head in this level position. And I'm going to put this skull down here for a second, but that can include, if my pelvis is tilted and my spine does a C curve here in order to try to counterbalance that, something's going to happen up here, because my body really doesn't want to keep my head in this kind of alignment over to the side. So maybe I'll compensate here in the neck, and maybe even that's not quite enough. So the temporal bones will start to shift this way, and the occipital will do the same kind of shift, and now we've got distortion in the cranial bones. So in explaining to this patient why I was doing measurements of her entire body, looking at her posture, and the need, telling her the need to kind of balance out this pelvis in order to create a proper spinal alignment, which then could allow her cranium to be in balance, and that would enable the neuromuscular dentist to get the best possible alignment they could with her TM joint and the occlusion of the teeth coming together as they were making prosthesis and that kind of thing. When we talk about jaw problems and dental problems, in many cases, we can attribute those problems to a postural distortion, postural dysfunction elsewhere in the body that then leads to misalignment and dysfunction in these joints up here. As a basic concept, that's what we're working with TMJ patients and dental patients who are trying to get dentures created or bridges that are going to work for them really effectively going forward. There's a couple of things, though, that I wanted to share with you that you can take a look at home to maybe get an idea of how well is this TM joint working for you? How well is the occlusion happening and those teeth coming together? One of the experiments you can try is to do something like just check how your teeth come together, whatever your normal bite is, and then tilt your head to the side and see how does that change it. It's going to change how those teeth come together. So that's a really obvious one, just to tilt the cranium like that. But you can do the same test. Click your teeth together, see how they come together, and then stand on one tiptoe. Raise up one foot so that it changes the tilt of your pelvis. I'm raising up my right heel right now and tilting my pelvis to the left. And then repeat that teeth clicking little exercise there, and you'll find that changes the way that the teeth come together. And that was down in my foot that change was happening. And that made a change in my pelvis, which changed my spine, which changed my cranium, and then my bite. So you can illustrate to yourself or any of your friends, it's a good party game to do, hey, let's try postural distortions and how we chew our hors d'oeuvres. But you can see very easily how that would change the way your teeth are coming together. And so checking yourself and your normal bite and how that might be working is fairly easy to do. You can stand in front of a mirror and open and close your mouth a number of times and watch how the jaw tracks. In many cases, people will see the jaw curve around in a C curve. As it's opening, it'll come down and around. And then back the same pathway as it goes up. It opens in a curve, it closes in a curve. Some people will see what we call an S pattern. It'll go to one side, and then the other, and then back down to the middle. A good way to see that, and I have a little bit of some aids right here, and I'll see if I can get this to work on my teeth. Just regular toothpicks, and you can help yourself to see this by sticking the toothpick, wedging it in there between the middle two teeth and the top and the bottom jaw. Right. So if we put this in here, and we put this in here. All right. Now we have a visual that will help us see the tracking here. And I love my voice on this video right now. So if I open, can't say the letter P with the toothpicks in. So I'm going to demonstrate this and then I'll explain what I'm doing. So okay, so I gave you 3 different examples there, and you may have even heard my own jaw popping. This is a personal issue for myself. I'm having some TMJ problems, but you could probably see from that video that there were that bottom toothpick as I was opening my mouth moved in different pathways. So I did a little C curve. I did a normal kind of straight up and down for you. I did a little C curve and I did a little S curve in there. I kind of just made my jaw move in that way. But you can stand in front of the mirror and look at that tracking on yourself and see, is my jaw working right, or do I maybe have a tracking problem? And that's why I get a pop in the joint when I'm chewing foods or I'm talking or I yawn. That's another thing to look for, is those kinds of symptoms. If you feel popping or clicking, even grinding sometimes in the jaw up by the ear, you'll hear those things happen. You can even stick your fingers in your ear and open and close, and you'll feel a pop sometimes. You'll feel maybe one side move and then the other side move, and that will correspond with the curving of the track of the toothpick here. But these are all ways that you can do a little self-assessment at home and look at your jaw tracking and experience how postural distortions can change the way your teeth come together and possibly contribute to some dental issues for you. So that's just a little bit of a nutshell overview of how we look at neurosomatic therapy and postural distortion as it relates to the cranium and the TM joint and the occlusion of the teeth. Hope you find it helpful.